Welcome to Health Law Pulse, the podcast where healthcare, compliance, and law come together in real conversations with the people doing the work behind the scenes. I'm your host, Jonathan Rhodes, a healthcare attorney and founder of Health Law Counsel, LLC. Today's episode is one I am especially excited about because we're talking about compliance as a strategic business partner, not just a regulatory checkpoint. I'm joined by Amy Smith, a healthcare compliance expert I have known for more than a decade. Amy brings more than 25 years of healthcare experience across compliance, health information management, revenue cycle, clinical documentation, and healthcare IT. Over the course of her career, Amy has led compliance oversight for complex clinical and technology initiatives at scale, including electronic medical record development, data governance, clinical protocols, and revenue cycle operations across thousands of facilities nationwide. What makes Amy's perspective especially valuable is that she sits at the intersection of compliance, clinical operations, technology, and the business, translating regulatory requirements into real-world workable solutions. In today's conversation, we'll talk about how compliance leaders can partner effectively with legal, earn trust with operations, and position compliance as a strategic driver of quality, innovation, and risk management, not a barrier to progress. Amy, welcome to Health Law Pulse. I'm glad you're here. Thanks for taking out some time to meet with me. For those that don't know, I haven't seen you, Amy, and probably I left. We worked together at DaVita, and I left in August of 2018. So it's been several years. That's probably the last time I saw you. So good to see you. Good to see you. Thanks for joining me. I am really glad you're here. I think it's really important. I want to explore a bunch of compliance topics with you, both substantive issues, but also ways of working, which I think are really critical. I'm sure that we both experienced that in the different organizations we worked with. But before we get started, can you just walk us through your career path in healthcare compliance? What drew you to healthcare? You've been doing this for more than 2 decades. What's kept you in that career? What sort of keeps you going?
Sure. Since you said I've been in it more than 2 decades, let's just say I started when I was like 5.
Yeah, well,
Um,
that's what I meant. That's implied. Absolutely.
um, so really my whole career started in kindergarten teaching, which is totally
Mm,
a random thing. But I got into working in medical billing. And one of the first places that I worked, I became the billing office manager, and I identified an FCA risk that we had. It was pretty significant. And so I was able to identify that, and we were able to get it resolved. And that felt really nice to be
right.
able to resolve
Right.
something.
Absolutely.
Yeah. And then the practice that I worked at was kind of large, and I decided that I thought it would be interesting to kind of help other private practices identify those kind of issues. And so I got into some consulting, auditing kind of work. And that just kind of, kept leading me down that trajectory to continue in the kind of more of the areas of compliance,
Right.
and brought me to DaVita at some point.
Yeah.
Yeah.
Excellent. And how long were you at DaVita? Remind me.
Uh, Almost 17 years.
17 years. And then since then you've been at radiology
Mhm.
partners within a compliance role. And so continuing to grow your expertise in a variety of different healthcare types of services, right? Not just one's particular lane, but compliance that translates across a variety of different service lines, which is great. So,
Yeah.
you know, Amy, one thing that I really wanted to explore with you, and I've had other clients since then kind of decide they want to build their own EMR, right? So their own electronic medical record system, clinical IT issues, compliance. But from a legal perspective, when a healthcare organization builds or customizes its own EMR, it inherits regulatory risk. There's HIPAA risk, there's information governance, billing transparency requirements. As you know, compliance becomes really a product safety, becomes a risk issue. And you've overseen compliance for EMR development and life cycle management. What do you think? uh, uh, You know, through your experience, what do you think organizations underestimate of building or customizing their own clinical systems?
Um, it's funny when we first decided to build our own internal EMR. One of the first things that I said to our IT leadership was, I think the hardest thing that we're going to run into is that too many people have good ideas.
Mm,
Uh, I think everybody has an idea about what they want to solve or what they want to happen. So I think one thing is really honing in on what your goal is for that system, what you want to change, what kind of risks you're trying to address, what kind of issues are you trying to remove or get rid of. I think that's really important, so you can really focus on the things that you need to prioritize. And of course, you want to get everything in there, but just understanding that that's probably going to take time, and you want to make
yeah.
sure that you're prioritizing in the right way.
And how does that so interesting that you say, there's the risk of everyone having great ideas. What is the downside to that? Like, if everyone comes with great ideas, from a compliance perspective, how does that become problematic?
Yeah. Um, I think it just makes it difficult to manage mostly, I
Right.
think. But the big thing is, some of those ideas conflict. Some of those ideas introduce compliance risk. And I think when you have a bucket of so many ideas, um, you really have to uh, under, like I mentioned, the goal piece, that understand the goal, because you'll have a lot of ideas that are going to uplift you financially. You have
Yeah.
a lot of ideas that are going to help your physicians with time. And so trying to understand what are your goals, because there could be compliance risk in there. And while you're trying to maybe advance your financial baseline, um, those might conflict with your compliance trajectory.
Right.
And you don't want that to get lost. And you want to make sure that you have the right engagement in each of those goals that you're trying to meet. So I think it's not don't do it. It's
Mm.
just make sure you're planning for it, and that you're ready to evaluate each of those ideas in the right way.
Yeah. So it's a great point. It probably requires some level of discipline, right? So is it fair to say that you start with here's our objective, right? Objective is usually streamlining revenue cycle, right? In a way that reduces DSO or day sales outstanding and denials and things like that. So reducing that cycle time, streamlining the process, enabling technology solutions to help with that. So starting with those objectives,
Yeah.
what are our goals as you mentioned? What are the compliance risks associated with those, and how do you prioritize that? And it's probably a balance. You tell me if I'm wrong. It's probably a balancing act between what are the most significant compliance risks with what are our main objectives here, right? So that to your point, streamlining revenue cycle. Obviously,
Mhm.
everyone wants to get their claims paid as fast as possible, and balancing that with any associated compliance risk, and how big is that risk? How low is that risk? And sort of it's just a constant balancing act.
And I think also maybe understanding um, what kind of what kind of things you can do outside of your system to
Mm,
maybe mitigate those risks
mm,
in the interim.
yeah,
So, are there other manual controls that you can put into place while you're trying to reach that goal, so that you're still meeting your compliance needs at the same time? I think just having an understanding of where there's that flexibility, I think, is helpful.
yeah. Yeah, that's a fair point. So, sort of, is it, I mean, not every compliance risk mitigation strategy is going to have a technology solution. So, to your point, what are the controls that you
Mhm.
can put in place? How do you monitor those controls? How do you audit those controls?
Right.
So that in when you think of compliance risk in this space,
Mhm.
EMR related compliance risk, what do you think is like? What's the first thing that comes to mind that perhaps executives may miss, or IT leaders, or whoever's on the business side, really kind of spearheading that kind of project?
Yeah. Um, I think there are probably, I shouldn't say probably, but I think that a couple that I've run into are, um, I think first and foremost is data management, which
Mhm.
I know is on everybody's mind. But I
Right.
think there are, some specific pieces of data management that maybe leadership doesn't have visibility to or understanding, and how to kind of build that in from the beginning. And then I think the second piece is really capturing oversight documentation. So, not
Mhm.
the external oversight of the system, but also within the system when you're talking about residents or nurse orders, things like that, that are really key for compliance, and could easily be built into the system. But if you're not thinking about it ahead of time, I think
Right.
sometimes that adds to some complexity.
Right. No, that's a great point. So, so data management, as you mentioned, on the minds of every data governance, another way to phrase it.
Yeah.
And you're right. I mean, a lot of my clients, it's data, data, data. What's the risk associated with the data? How do we control the data? How do we monetize the data in certain instances? But governance is so important. And what's clear from that discussion is that we just had regarding EMRs is that I mean, EMR is clearly not just a tool, right? It's a regulatory artifact. And the way it's built, the way it's customized and maintained, directly shapes compliance risk. And once you step back from that system itself, the next layer of risk becomes that data, the data
Yeah.
that the system creates, that it stores, that it
Mhm.
moves, because under, as you well know, HIPAA, CMS requirements, and expanding proliferation of state privacy laws, and how clinical data is structured, governed, and is used determines the organization's legal exposure. So I kind of want to shift gears from the EMR as a product to data governance as a regulatory strategy. And it's a great sort of segue to this other topic. And under these federal and state regulatory requirements, how clinical data is structured and stored, as I mentioned, dictates our legal exposure. And data governance no longer becomes an IT policy issue. It's really a regulatory survival issue. And you've been a data governance lead. And what does good data governance look like in 2025? Certainly, I would suspect looks very different than it did 10, 5, 10, 15, 20 years ago. What does it look like today?
Yeah. Um, really, I think, as you kind of alluded to, it's thinking of data governance as its own function.
Mhm.
It's not part of IT. It's not just your HIM department. It's not just your billing team. It's its own function. I think uh, uh, there we are now at the point where we have so much data, and data gets accumulated so quickly. And there are so many variables to the laws about how we manage that data, not only from a HIPAA perspective, but from a continuity of care perspective. We
Sure.
have, so much information sharing that is now required by many states, to share with their state HIEs and things of that nature. So really building that framework. And I always say you want your documentation around how you're managing your documentation,
Mhm.
because you really need to build out that framework of what data are you capturing? Who needs that data? How are they accessing it? What does that data look like once they access it? You have lots of different groups. It's, medical records teams, it's state, federal reporting, it's billing, there's so many different components. And of course, there's, clinical oversight. They need to have visibility to that data. How does that look, and how do we manage it? How do we manage who accesses it, how it gets distributed, what it looks like, and what we do, at the end of that life cycle? That's a huge discussion that a lot of companies are having right now. Is we now have so much data. We've been using an EMR for 10, 15 years now. That life cycle of managing that data is now ended. What do we do with it? How do we get rid of it? How do we keep it? It's costing us all this money to keep it. So I think just a strategy and framework really needs to be kind of its own mindset that just integrates with the other teams. So
Yeah, no, that's great. And or maybe not so much how do you get rid of it? Because in some cases, I think that's right. It's how can we use it, right? How can we benefit from it? And maybe even on a de-identified level, right? Not necessarily talking about identifiable information, but how can we monetize or utilize this data to help benefit us? And that kind of brings in, I don't really want to get into this right now, but sort of the artificial intelligence and all these health systems and provider types sort of creating their own AI tools, and to what extent can it utilize de-identified data to train those tools and to
yeah.
develop those tools, and what's the regulatory legal framework about what they can and can't do. It's all it certainly was not even a blip in anyone's radar 5, 10 years ago, even a few years ago. But today it's a very real consideration, and a lot of provider groups out there are either doing or thinking about doing something like that.
Absolutely. Yeah. And it's really a key element of, if you're going to capture all this data and house it and spend money to hold that data, it makes sense to be able to
Yeah,
use it for things that you need long term, or to help your financial baseline, or to help develop other AI strategies. It's really key to
yeah,
how you're going to do long term.
right. And with the increasing discussions regarding legal
Mhm.
framework around AI and data, it's that I mean, the governance conversation is even more important, right? How do you govern that data? How do you internally decide when and when it can't be used, and and even more important, what levels of approval do you need in order to make those decisions, right? So you're just not kind of willy nilly, have teams sort of deciding how they're going to use data. It's got to have some structure around it.
And I think understanding how you're gonna, I think a big thing that we talk about a lot right now is how you're gonna monitor those regulation changes. I
Yeah,
mean, every day we're getting new regulations in different states and
right.
federal regulations. How are you gonna make sure you're still meeting those regulations as they change and adjust and go away and get
Yeah,
updated? It's a really consistent, I don't want to say issue, but it's a really consistent
yeah,
focus.
sure, absolutely. It has to be, absolutely. Yeah, I mean, yeah, that's a very interesting topic, and we could talk about
Yeah,
data
yeah.
governance forever. I mean, one of the themes that keeps coming up here, my takeaways from this discussion is that, clearly data governance decisions, they don't just live in policies, right? They show up when an organization is under scrutiny. How data is structured, stored, retrieved, it becomes critically important the moment a government auditor shows up, right? And that leads directly to the next topic I want to explore with you, because many organizations underestimate, I think, in my experience, that audit response itself is a
Mhm.
compliance discipline, and it has to be very strategic, or it could be really mismanaged documentation, inconsistent narratives, poorly structured EHR data. It can turn into it can turn an audit into a multi-million-dollar exposure pretty quickly. And Amy, you've built and led audit response frameworks. You know, when I think, and I've dealt a lot with reimbursement litigation, audits, state level sort of survey audits, and RAC recovery audit contract. For those that aren't familiar with the plethora of acronyms we use: recovery audit contractors, ZPIC, zone program integrity contractors, and Medicare administrative contractors, all related to sort of the government programs related
Mhm.
to healthcare reimbursement. What's the number one mistake that you've seen organizations make when responding to these types of audits, or a mistake that just comes to your mind with respect to these audits? I can think of a few, but I'd love to hear your
I know.
I would love to hear
You
your
only picked one?
perspective.
No. Um, yeah. Yeah. You know, I think just to kind of preface my answer, there is a lot of focus on Medicaid and funding Medicaid right now. So
Mhm.
I think it's important also to keep in mind that those audits are likely just going to continue to increase as
Sure.
Medicaid try to, solidify their baseline. Um, but I think some of uh, uh, the big pieces that maybe just aren't top of mind for a lot of companies are in responding is number one, timelines. And then number two is content.
Yeah.
So how quickly, I think one thing is how quickly we're getting the notification that we get those audits.
Mhm.
Where are those audit requests going? Are they going to the right people? Do they understand what those timelines are? And then who is submitting? Do we understand what we're sending out in response to those audits? Are we aware if there are issues in that documentation that we're responding with, that we're prepared to respond or address or have mitigation strategies already in place if there's something wrong?
Mhm.
So I think those are probably the big pieces that maybe folks don't think about as much ahead of time until they until they start getting some negative responses to their audits. So
Yeah. Uh, yeah, those are great points, and you hit on something that really came to my mind first, which was where are these? So typically, at least in the reimbursement world, excuse me, the audits will start with a request for documentation, right? So the contractor will send a list of we want the encounter records for these 10 patients, these dates of service, and so on. And especially when you're working for large organizations, those letters may not go to the right folks, or they'll go to folks that just aren't sure what to do with it. And so by the time it gets to the right folks, it's either just shortly before the deadline or after the deadline for responding. I've seen that many times. And so, to a certain extent, it's very difficult to manage that. Again, especially when you're talking about a large organization with thousands of facilities or hundreds of facilities nationwide. But to the extent that you can provide education on, if you're working with an organization that has facilities in 30 different states, and the facilities are the ones getting those audit responses. Well, there's the corporate office that typically is the one that handles the collection of the records, the response to the audit. And so to the extent that you can educate the facility management that, hey, when you get something like this is a place where it needs to go as soon as possible. This is really important stuff. You don't just want to sit on it for a few weeks and then ping somebody and say, hey, what do we do with this?
yeah.
So yeah, I think that's really important. But with large organizations, time and time again, I have seen that many times, and I end up almost every time asking for an extension because by the time you get it, you're right about that deadline.
Yeah. Yeah, absolutely. I mean, I think it's key that, folks on your front line, your administrative assistant who's getting a stack of 50, letters every day, that they
Right.
know where theirs are supposed to go. They don't have to manage them. They don't have to respond to them. They just need to know where they go. Just making sure that folks are aware
Yep.
of, what they're receiving and where it's going.
Yeah. And I think part of that education is preparing those teams to be audit ready, or clinical teams, or how do you prepare clinical teams, or teams that are responsible for something that's being audited to be
Yeah.
audit ready without overwhelming them?
Yeah. Um, I'll get on my soapbox.
Please. Yeah.
I feel, and I think this kind of feeds back into your EHR, your EMR.
Mhm.
If you have the capability to really streamline that response. So,
Yeah.
one, making sure they're getting to the right folks. That's great. Making sure your frontline folks understand where those are supposed to go. But I think to that second point about the content, can you build reports or can you build something to where you have a single button to push where, hey, I just need these records for this
Mhm.
patient from June through July. And if I push this button, I know all the reports and all the pieces of the medical record that are going to be responsive to that audit are
Yeah.
already included. Uh, and I think that's where it's really helpful to have your compliance partners in on some of that development to really ease that strain and make sure that you're responding to those audits in the right way and not hitting your bottom line at some
Right.
point, you know?
Yeah, I love that. Yeah, to the extent we can streamline responses, that's so important. And even, I think in addition to that, the way to be audit ready is to really implement what is being audited well before the audit, right?
Oh,
So understanding just as an example, what are the documentation requirements for this particular CPT code?
mhm,
What are what do we need to do? We need to make sure what physician supervision requirements are here, and making sure that those are well documented and
mhm,
audited and monitored as part of your compliance program and your risk assessment. I mean, that's sort of step one, right? Then the second piece is, okay, well, how do we quickly
yeah,
get the documentation in order to respond to the audit? I mean, then it gets a little bit less overwhelming, I think, when the actual time comes.
exactly,
Yeah,
exactly. Not
excellent.
so much pressure.
Absolutely. Well,
Right.
so I love this substantive piece of our discussion. I want to shift to one of my favorite topics, which is ways of working. And you, Amy, have been in compliance, have a lot of experience there. You've led compliance across 3,000 facilities. How do you get alignment at that scale? Like, I mean, really, I mean, it's you're dealing with a lot of different personalities, a lot of different. I mean, you certainly have an institutional risk tolerance, right? Like, and what is that organization's risk tolerance? And you can sort of drive from there. But you also have individuals that have different risk tolerances, right? And that are in various levels of management positions. And so, how do you what's the challenge there? How do you get alignment across so many different facilities? With respect to compliance issues.
Yeah. I'll I'll start with where I kind of started in
Yeah,
my story in compliance, which is I really at the beginning wanted to make everybody happy.
yeah,
And I think the first step is just really knowing not everybody is going to be aligned at some point. I think
right.
the the key is uh, uh, helping them to understand why, even if they don't like it, or even if they think it's not necessary, um, because our risk tolerance is here,
Mhm.
we have to do this to get to
Right,
that risk tolerance
right.
level. And helping them understand why that is, why that's meeting the risk tolerance level, why it's important, what the impact is going to be if we don't meet that risk tolerance level.
Hmm.
What are some of the other manual things that are going to have to be in place where we're going to have to spend money on employees who are manually doing things and monitoring and oversight if we don't meet that risk tolerance level in our systems or in our
Yeah.
processes? Um, just really helping them to understand. And I think I will say, I don't think that I've ever gotten to the point where it's where folks have said, no, I'm not doing it. I'm not touching it.
Right.
I'm not gonna meet that compliance requirement. I think it's just vital to really kind of create that trust
Mm.
with your team and with the people that you're serving in a compliance perspective to that they know that you really are there to support them, even if they don't love
Yeah.
asking them to do.
Yeah. Well, I love that comment because I've certainly worked for organizations and I've seen both sides of this. I've seen organizations where it was sort of this us versus them mentality. Um, it's compliance won't let us do this, or compliance and legal. I shouldn't just throw compliance under the bus. And legal won't let us do this. They're inhibiting our growth.
Hmm.
I've seen that, but I've seen it where it was more of a strategic team atmosphere, right? So legal, compliance, operations, business development, product. It was more of a team environment where, yeah, I mean, it did. I mean, there's always natural tension there, right? Because you've got one side that wants to grow and develop the business. Not that legal and compliance don't want to do that, but it's got to be within the right framework, and so that raises natural tension. How do you prevent, in your experience, that this us versus them mentality and get to that sort of team uh, environment, or that idea that we're all part of the same strategic team?
Yeah. Well, I think one of the big things that I try to remember is that if handled in the wrong way, that us versus them is not just compliance and legal in the business. It could
Hmm.
be your clinical and finance, right?
Absolutely.
It
Yeah.
could be your marketing
Yeah.
and your I don't know, your operations folks. I think e- e- everybody has kind of their own priorities. And so one, I think it's important to understand what the priority of the business is as a whole. I'm hoping if you're in healthcare, um, that the priority is the patient and
Right.
the health of the patient. But there are lots of other priorities that need to be considered. Are you making enough revenue to stay alive?
Mhm.
So I think one of the key components that I've really had some success with is it sounds so simple when I say it, but getting to understand your business, right?
Mhm.
What are
Oh, yeah.
what are and personally too. I mean, you don't have to
Yeah.
like everybody, but getting to know everyone personally. What are their personal goals? What are their goals for their team? What are their goals for the company? And then making sure you're investing that time that they know that you are invested in their success, that what you're recommending is going to help their bottom
Mhm.
line. You want the business to succeed and make enough money. You want those patients to be healthy when they walk out of there. You want the doctors to be spending their time and their focus on the right things. um,
Yeah.
that's super important. And I think when they know that you're invested and that that's your priority as well, there's a lot more trust and respect there. They know that you are only telling them not to do things when it's really going to impact their
Yeah.
goal. And so I think that's really developing that relationship with your business partners and with your legal partners.
Mhm.
I think is really really key.
Yeah. I totally agree with that. So since you said that we don't have to like everyone we work with, let's spend a few minutes on all the people that didn't like me, Amy. Um, we may not have enough time on this podcast
Oh my,
to go through that. I'm kidding. I'm sure there was no one that didn't like me. I'm sure of it. I'm sure of it. Um,
there
what?
were many days of mourning when you left.
Oh, right, right. I'm sure. I'm sure. What does so? I I mean, I love what you said in terms of kind of developing that relationship. I think that's that the relationship of trust, and I've always viewed. You tell me if you think compliance is different. Maybe it's a little bit different. Maybe it's very much the same. But when I think about giving legal guidance or my role as an in-house lawyer, and even as external counsel, but much the same way that I like to give legal guidance on a spectrum of risk, right? There are very few things that I think that are proposed that are absolute no's.
Yeah,
No, that
exactly.
is 100% illegal, right? Now,
Right.
there are low risk proposals, there are
Mhm.
medium risk proposals, and there are high risk proposals.
Yeah.
And so I always like to give legal guidance in within that framework. Like, yeah,
Mhm.
this is probably a high risk. Now, here are some things you can do to mitigate that risk. Maybe get it from high risk to medium risk, or medium risk to low risk, or so on. And maybe there aren't. And so
Yeah.
but that's part of the discussion. But I found that business always appreciate in operations, and clinical safety, all these teams appreciate the risk discussion. They appreciate education on the legal issues, and they appreciate to the extent that we're trying to find practical solutions to reduce that risk. Do you find the same kind of the same the same framework applies to compliance?
Absolutely. Yeah. And I think, I know we've talked a little bit about EHRs and
Hmm.
information governance. I think, really becoming part of the team. And so,
Yeah.
you're getting engaged early, and you're helping them to kind of pre-navigate issues because you understand where they're headed, and
Yeah.
what they're trying to do, so that those compliance pivots don't feel so big.
Right.
You're not the day before you're releasing a new functionality in your EMR and compliance is saying, "Oh my gosh, you're going to fail every audit if you release that tomorrow."
Yeah. Yeah.
Um, you're in there early, so you can say, "Just add this one little button here, and you are going to be safe from audits for 10
Right.
years." I'm,
At least prepared. Right. Yeah.
you're
Absolutely.
you're ready. And
Yeah.
I think it's really getting that engagement and as a compliance person, being willing to understand that we might have to do some manual auditing, oversight kind of
Mhm.
activities, that are going to be separate to kind of mitigate some of that risk, and being open to that, and being open to guiding the business on how they can address those things outside of the regular process, and mitigate some risk. And I think it's really important. I think, like you mentioned, to not go in there ready with a no, but go in there ready with
Yeah.
a, this could happen. So let's figure out how we can help that not happen.
Yeah. Don't become the Department of No. Amy, what you just said made me think of another really important, I think, piece to developing that sort of team atmosphere, and it's how we approach issues, and in terms of our demeanor. Right?
Yes.
There is a huge difference in my experience between approaching even the just worst case scenario issues that come up, like terrible legal issues, and with a calm demeanor,
Yeah.
and say, okay, this is it, that allows everyone to kind of sit back, think about this critically and logically.
Mhm.
And I found that business folks are willing to put their trust in you more if you approach things calmly, right? You cannot approach, even if it's really just a tough, tough issue, with a sort of a hair on fire approach, or in my case, not. I mean, that maybe that's what happened with the hair. I don't know, but
You're welcome to some of mine. Yeah.
yeah, yeah. Thank you. I'll take it. Um,
Yeah.
but you know what I mean? I mean, have you seen that?
Mhm.
Because I have seen, both compliance and legal, that, folks that are just kinda like they're naturally like, I mean, this is just who they are, right? And it's tough to change that.
Yeah.
But, everything is just an emergency, and everything's very frantic, and
Mhm.
it typically doesn't go over well.
Yeah. Oh, absolutely. And I
Yeah.
think it's funny because I know once you really this has happened to me more times than I like to admit, but once you develop that relationship with your business partners or clinical partners or whomever, and you're really in there day to day, fighting the good fight with them,
Mhm.
and they bring you an issue, and like you're on video, and they look at your face, and even they'll go, "Oh,
Right.
this is going to be a bad one."
Yeah. Yeah,
They
that's
don't
fair.
you don't have to say anything. You don't have to go in there and yell and, scream and cry. You can just go, "Oh."
If you're normally calm and then all of a sudden you're bug-eyed, yeah, you know there's an issue.
Right. Yeah, yeah. But I mean, and they trust that. And especially if you're not going in there every day with your hair on fire,
Mhm.
I think that's going to add a lot more validity and focus from the teams that you're supporting when you do come in there and say, this is gonna be a tough one. We're gonna get through it
Mhm.
together, but this is gonna be a tough one. They're gonna
Yeah.
go, okay, this is really gonna be a tough one.
Yeah.
So I
So
think it just
important.
helps them to really understand the magnitude of what they're doing.
Yeah, absolutely. Just approaching things with calm
Yes.
is so important. It's so important. Well, Amy, I'm gonna leave you with this last question. What advice, you mentioned a number of times about getting it early, right? What advice would you give to a compliance professional who wants a seat at the table earlier in the decision making?
Yeah. Two things. I think one is getting to know the people that are making the decisions. I
Mhm.
think that's pretty obvious. Becoming a recognizable face, a recognizable name to those folks, I think is important. But two, what I think sometimes people a lot of times miss is finding out who those people that make decisions trust. So who are they looking to for their answers in IT and
Right.
clinical and finance? Who are they asking the questions? Getting to know those people. Why do they trust them? What is that? What are they bringing to the table that helps that person who's making the decision make the right decision? Um, and then you coordinate with those other people that are providing that guidance because they're gonna get to know you. They're gonna understand what you bring to the table. They're gonna understand how you contribute to the guidance that they're giving as well.
Mhm.
I think that really opens up a lot of invitations, maybe to maybe more invitations than you want to call.
Could open the floodgates. Yeah.
But the people are gonna think of you. They're gonna look at the
Yeah.
list of names on that call and go, we could really use Amy on here, or
Yeah.
I want to hear what Amy has to say on that. I think that just really contributes to, and it contributes to you feeling like you're being successful in your role of supporting the business. I
Yeah.
think that's helpful as well.
Yeah, I love that. I mean, the most high functioning teams I've seen and I've been a part of are those that involve compliance and legal early in the
Yes.
decision making process and it's more efficient, right? I mean, it's sort of can help guide and direct that conversation.
Yeah.
Um, yeah, that's great advice. I love it. Well, Amy, this was awesome. Thank you for your time. Thanks for joining me today on Health Law Pulse. Your experience connecting clinical workflows, compliance frameworks, technical systems, incredibly rare, incredibly needed. Really appreciate your time and for imparting your wisdom with all of us. So, and to our listeners, thanks for tuning in. If you enjoyed today's episode, subscribe, leave a review if it's good. We're on YouTube, Spotify, Apple Podcasts. You can also find these links to these episodes on my website at www.healthlawcouncil.com. I'll see if I can read the rest of this. We'll be back soon with more conversations at the intersection of healthcare, law, technology, and leadership. Thank you very much, Amy, and take care.
Thank you, John.
Thank you for joining us today on the Health Law Pulse. This podcast has been brought to you by Health Law Council LLC, a healthcare law firm you can rely on. For more information about the services offered by Health Law Council LLC, visit www.healthlawcouncil.com, or you can email me at john@healthlawcouncil.com.